This might be a little bit tough, but I literally just learned from Congressman Brendan Boyle, ranking member on the budget, who just learned tonight that there's $500 billion in cuts to Medicare. We know there's the destruction of Medicaid in this bill. How is it that we're just finding out something like devastating cuts to Medicare?
Yeah, and this is part of the reason why they decided to do this as a budget reconciliation process. And that's a bunch of fancy words to say. They've done it behind closed doors. They've cut all these little deals. And as the bill text rolls out, that's how we'll find out all the specifics. We know a lot of the general things, and that's what makes this process so disgusting. I mean, we just literally like 3 hours ago received the Congressional Budget Office score for this, knowing how much it's going to add to the deficit. And we learned that the top 10% will receive most of the benefits, and the poorest 10% will lose most of their wealth over the course of 8 to 10 years because of this bill.
And the effects on rural hospitals, I mean, it's already there's a collapse of rural hospitals across this country right now, before this happened. You kick Medicaid out from under them, there's not going to be hospitals in rural areas.
Hospitals, clinics, which oftentimes are the first place someone's going to stop at. And here's the thing: a lot of people think this isn't going to impact them if they're not on Medicaid. You are wrong, especially if you live in a rural community. A lot of these hospitals that are shouldered by Medicaid do not only service people who are there on Medicaid. They help people who have absolutely no insurance at all. They help people with private insurance as well. These hospitals will shelter, will go away literally in a matter of months, and some reports say days. And so this is something that's going to impact everyone.
Congressman, what can people do to fight back?
Yeah, well, first, I mean, I appreciate everyone being here right now. Part of the reason they're doing this at 1 a.m. is because they think no one's going to show up, no one's going to care. And so by being here, by being loud during the hearing over the next several hours, it's really going to help us put the pressure on the Republicans in the room. The other thing is reaching out to these Republicans. Continue to do the phone calls. Show up to their offices tomorrow, like early in the morning. Send the letters. Call the office. Show up here in D.C. if you can. The pressure is working.